and we'll go from there.
Welcome, everyone. Let's just give people one more minute, and then we are going to start the webinar. Good morning, good afternoon, and good evening. My name is Bruna Bimbato, and I'm the events coordinator at ICM. I'd like to welcome you to our Push for Women's Health event today. Feel free to introduce yourself and share comments during the webinar by clicking in the chat. And if you have any questions, please use the Q&A button. To give you a little bit of background on our activities, on International Women's Day on 8 March, Push launched the second phase of its campaign with a renewed focus on centering women and championing midwives as the key solution. And then on May 5th, ICM held an event celebrating the International Day of the Midwives, and we celebrated with almost 1,000 midwives around the world, and we highlighted their critical role in crisis and health systems. During our IDM celebration, we brought together midwives and global leaders representing all ICM regions. We spotlighted the leadership of 6 frontline midwives working in crisis settings, and we also highlighted the work of 5 ICM member associations. We learned from global experts and watched a series of different documentaries about the work midwives do during crisis. And in case you missed it, you can watch the recording on YouTube. And if you can please share the link in the chat, that would be great. Building on this momentum, ICM and the Push campaign are excited to bring together champions, allies, and partners to push for rights for women and for midwives in honor of the International Day of Action for Women's Health, today on 28th May 2025. And before we get started, we want to hear from you through the Slido. Maret, can you? Yeah, thank you. So this is how it works. You scan the QR code and then you answer the question using 1, 2, or 3 words. What's women's health issue matter most to you? For those who are not familiar with the activity, once we start getting answers, the largest words in the word cloud are the most frequent ones amongst our participants. Safe birth, bodily autonomy, menstruation, respectful full care, sexual and reproductive health, menopause, mental health. Great. Very interested to see your priorities when it comes to women's health. Thank you so much. Our time today, Marat, can we move to the agenda? So let's see the agenda we have for today. So our time together will start with the opening remarks from ICM's chief midwife, a brief presentation about the Push campaign, a round of reflections from global experts around the role of midwives in addressing women's health, followed by a pledge drive celebrating women-centered care champions and their commitments to the Push campaign. And then we'll close by inviting all of you to join the movement and share resources on how to engage with the campaign. To get us started, I'd like to introduce Jacqueline Dunkley-Bent, ICM's chief midwife, to give our opening remarks. JDB, the floor is yours.
Thank you, Bruna, and good morning, hello, good afternoon, good evening to all our partners, champions, and allies joining us from around the world. My name is Jacqueline Dunkley Bent, and I work as the Chief Midwife at the International Confederation of Midwives, frequently abbreviated to ICM. And of course, I'm a midwife from the UK, but living in the Netherlands, in The Hague, at the ICM head office. It's my absolute pleasure to join you today, commemorating this important day of advocacy and action. Today, on International Day of Action for Women's Health, we gather to spotlight a truth that is both urgent and powerful. Midwives improve childbirth outcomes and women's experiences. Midwives save lives. And of course, we work collaboratively with our obstetric colleagues, our gynecologists, and of course, our pediatricians, neonatologists. The evidence about midwives saving lives is compelling. The evidence shows it. Policies showcase it, and you need to believe it. Too often, when we talk about midwives, we limit the conversation to pregnancy and childbirth. But let's be clear, midwives are not just birth attendants. They are skilled, competent providers of midwifery care, providing a wide range of services that support girls, women, and adolescents at every stage of their lives. From contraception to menstrual health, from fertility support to menopause, and even mental health. Midwives are often the first and sometimes the only point of contact in the health system. And that would be for millions of women and gender diverse people. As a midwife myself, with a career of over 3 decades, I am educated to listen and to place women at the centre of everything that I do. And I'm sure all the midwives in this space would say the same or strive for that. As midwives, we provide women and their families with respectful care. We inform them so that they can make good decisions. We empower them, and we focus not just on their bodies, but on the emotional, social, cultural, spiritual aspects of health and healthcare. ICM supports the right of all people to receive humanised and inclusive midwifery care, regardless of the colour of their skin, how they speak, the accents that they speak with, their sexual orientation, gender identity, gender expression. What midwives do ripples through generations. And let me give you an example of what that ripple can look like. You know, with regards to genetics and epigenetics. And for those that aren't familiar with epigenetics, epigenetics refers to how our behaviors as people and the environment that we live in can cause changes that affect the way our genes work. And unlike genetic changes, the mutational changes, epigenetic changes are reversible and do not change the sequence of our DNA bases, but they can change how our bodies read a DNA sequence. Now, why am I telling you all this? I started out by saying what midwives do will ripple through generations, and the midwife's contribution during the antenatal period is absolutely vital. The intrauterine environment is responsive and sensitive to stress, hormonal disturbances, exposure to toxins, insufficient nutrition, and that leads to long-term health effects. These can influence fetal development in the short term and drive adaptive changes that may well mean that in middle age, that baby in utero that was exposed to toxins may well have cardiovascular disease in later life. And we know this to be the case for tobacco consumption. But infants exposed to acute malnutrition in early pregnancy are more likely to be obese in later life. So, midwives are primarily placed and are really well placed to advocate, to educate, to support women during the antenatal period. If these things are disclosed, midwives provide primary care, public health, and health promotion, diet, nutrition, toxins, smoking, drugs, alcohol, stress. The midwives are firmly placed in this position to make a difference to the intrauterine life, and that means the environment within which the baby lives. And as I mentioned, epigenetic changes are reversible, and the midwife can help in that space. But midwives are more than service providers. We're advocates fighting every day to ensure that care is not only available, but also respectful, dignified, and rooted in human rights. The care we provide, is deeply relational. It's grounded in listening, in trust, and in supporting informed decisions. And of course, this is women centered care. And yet, even in 2025, women are less likely than men to receive person centered care. That must be changed, and it starts with us. Midwives are key to making the change. You're key to making the change. And this is why ICM is proud to be hosting the Push campaign, the global campaign for women-centered care, advocating for midwives as the way to get us there. A recent World Economic Forum report showed that closing the women's health gap isn't just a moral imperative, it's a smart investment. It could benefit nearly 4 billion women and generate 1 trillion for the global economy by 2040. And if people in your areas of influence aren't interested in person-centered care, I tell you, they will be interested in the savings, in the money, in the efficiency. Midwives are critical, of course they are, yet missing piece of the solution. They are the missing piece of the solution, without a doubt. Midwives deliver up to 90% of essential sexual, reproductive, maternal, newborn, and adolescent health services, especially in under-resourced settings where women are most often left behind. At ICM, we don't want to leave women behind. We will leave nobody behind. Just because of where you live, the color of your skin, your gender, your sexual orientation doesn't mean that you are left behind. This is why we push. We push for midwives because they are central to supporting the development of health systems that serve women, not just during childbirth, but throughout their lives. We push for women-centered care because no health service is complete if it doesn't uphold rights, autonomy, and dignity, respectful maternity care. And we push together, united across sectors, across borders and communities. We are equal but different. And we demand a future where every woman, everywhere, has access to the care she needs and deserves. And so, today, it's an honour to welcome our partners and women-centred care champions from around the world as they make their commitments known about why they push for midwives. Today, we invite you, all of you, to add your voice to this global campaign and sign and share the Push Pledge. We invite you to join the movement and recommit to placing women's voices at the centre of all we do and transforming health systems by championing midwives. Thank you. Over to you, Merit.
Thank you so much, Jacqueline. Good morning, good afternoon, good evening, colleagues. It's really a pleasure to read your introductions in the chat, to see all of you joining from around the world. I think truly this webinar and its participants are representative of this movement, a global movement spanning every continent, every time zone. And so, adding my warm welcome to all of you. My name is Mirat Khalil. I am based in Egypt and I am the push campaign lead at ICM. And it's really an honor to wish all of you a happy International Day of Action for Women's Health. I will give a very brief overview of the push campaign. I think many of you are probably familiar with it by joining. And so I want to just tell you a little bit of the story of where we've been just this year. So on International Women's Day, as Bruna shared, we relaunched the next chapter of the push campaign, really focusing on the campaign centering women-centered care. And so this is becoming now a movement of women-centered care champions around the world that are advocating for women and for midwives across all of these different areas that many of you mentioned in the Slido. During this kickoff event, we launched our new strategy, our new website. We announced the Push Pledge, 4 different tiers of engagement to become a woman-centered care champion, which my amazing colleague Anna will walk you through at the end of today's session. And we also held our first event at the Commission on the Status of Women, which was iconic. For one of the first times ever, we had images, powerful images representing about 14 different countries, all regions represented in the halls of the United Nations, showing midwives providing women-centered care and midwives as advocates and allies to women in their advocacy. And so I want to show you a few images. And of course, as we kicked off this second phase, we also convened allies and advocates. And I'm so honored and so happy to have another moment of this today. Here you will see some of our colleagues and some of the women-centered care champions from our launch, just to give you a bit of a taste of who are the faces behind the movement. And now joining all of you, adding your faces and voices to the movement. A few more photos of the Push photo exhibit, and I'm so happy to see some of the midwives who are actually in this exhibit joining this webinar. So this photo exhibit showed a mix of key advocacy messaging, making the case for midwives, and also showing the real life stories of who midwives are, what are the types of care that they provide, and trying to shift this, especially in crises, which was the theme of this year's International Day of the Midwife. And we were honored to receive a number of dignitaries, including ministers of health, ministers of gender, advocates from all around the world, feminists from all around the world who are attending the Commission on the Status for Women this year to visit the exhibit and to add their voice to the Push campaign. So, the Push campaign, as mentioned, is the global campaign and the global movement for women-centered care, advocating for midwives as the way to get us there. And so many of you joining this call, you know the power of midwives. You know that midwives are the solution. And you know that midwives are the champions for centering women in their care. And it's that simple message that we want to take forward and that we want to amplify loudly around the world. So, sharing a little bit through this QR code, this is the link to our new strategy. And so to share briefly about what is the new strategy of the Push campaign. Push campaign is working on 3 primary pillars, and I make this joke often, but you will never forget it. I'm from Egypt, and so of course, there has to be a pyramid for our strategy. The base of the pyramid being the most important part of the strategy, which is building the movement through our partners, through all of you. This is your movement. ICM may be hosting the event, but ultimately, this is all of you. It's all of your voices and it's all of your demands for women-centered care and advocacy for women, for rights, for midwives. The 2 other pillars of this campaign are a policy pillar as well as a public-facing pillar. Across the public-facing pillar, we want to mainstream this image of women-centered care to the public. We want to see more awareness of women-centered care as the standard of practice and more demand for midwives as the provider of choice. We want to stop hearing this very common story that we hear from some lucky women who say, I had respectful care and I had empathetic, compassionate, empowering care because I was lucky to have a good provider. We want to see women-centered care as the norm and standard. We also want to see so many more policymakers and not just ministers of health, but ministers of finance, gender, labor, climate, parliamentarians pushing for midwives with us. Midwives are not just a health solution, but they're a solution across different sectors. And last but not least, we want to use we want you to use this movement and to use the wide range of all of the advocates and allies that you're seeing in the chat, literally spanning the globe, to echo and amplify and build this community and build this alliance of centering women and centering midwives as a solution. So through this QR code, you will have access to our new strategy. I invite all of you to read it. I have to give credit to our amazing designer who's made the strategy look beautiful. And I want to give you a heads up that many of you are quite busy. So I encourage you to go to the executive summary of this document, which is found on the last 2 pages. Campaign summary in one page, front and back, and outlining the steps for each of these 3 pillars. Lastly, I want to share this paradigm shift that midwives and the Push campaign are responding to. In 2023, White Ribbon Alliance and partners, and I'm so happy to see many of these partners also on this call, ran a massive global campaign, listening to 1.3 million women and girls around the world, representing every region, asking a very simple question: what do you want for your health and well-being? How do you define women's health? And unsurprisingly, women and girls around the world, the youngest person participating in this campaign was 6 years old, guys, the oldest being 103. Power to them. Very inspiring. And unsurprisingly, women are demanding a holistic approach to their health and well-being. They don't want women's health to be fragmented to issue areas. They don't want women's health research to continue to be so focused on what people are calling the bikini areas that are often so wrapped up in stigma. But women and girls around the world were saying women's health is holistic, it's comprehensive. It links universal health coverage, financial independence, freedom from harm and violence, clean environments and climate. And it says the intersection of all of these things is women's health. And so in a very, very clear response of support, the Push campaign said, yes, midwives are in partnership with women and their advocacy around the world. And where you see women advocating for all of these areas, you will also see midwives. And this is really at the core of the Push campaign, advocating for women-centered care with midwives as the way to get us there, outlining the partnership between advocates and midwives. So, before I introduce our experts to share some of their reflections, we want to hear from you. How do you push for midwives as the key to women's health? Once again, we invite you to open the Slido using this QR code and to put your answers. We would love to hear from you. And this question will remain open for you to input some of your answers. I see some folks are already sharing their responses in the chat. And so hopefully a few more colleagues will be sharing their responses via the Slido. So as you put those answers in, we can come back to this. I want to use this opportunity as you're inputting your answers to introduce our upcoming experts who are going to share some of these reflections. We're very fortunate to hear from 6 incredible women's health advocates from around the world. And this will be a mix of some of their reflections and interventions from IDM, the International Day of the Midwife. So let me introduce Pascal Alote from WHO, Nina Soder from MSF, Faisal Kak from the American University in Beirut, Kathleen Sherwin from the World Economic Forum and Plan International, Natalia Kanem from the UNFPA, and Faye Callahan from the ICRC. And so as we get started, I'm going to kindly invite my dear colleague Anna to start queuing up some of these reflections. And so for this round of reflections, I wanted to just emphasize how honored we are to hear from these global experts and global leaders and women's health champions at all levels. And I want to also just share and encourage all of you to re-watch and revisit the International Day of the Midwife celebration that Bruna referenced earlier on. Given how successful this International Day of the Midwife 2025 celebration was, with the focus on midwives critical in every crisis, we really wanted to highlight some of our favorite reflections that we heard, highlighting the role that midwives play in providing women-centered care, especially in crisis, and that women-centered care is non-negotiable, even in the harshest of circumstances. We also want to spend some time reflecting on what does it look like to provide women-centered care and to ensure women's health is a priority in the midst of stigma, in the midst of crises, in the midst of difficult humanitarian situations. And what is the role of midwives in providing the wide range of women-centered care? So, with that said, I want to introduce our first reflection from Pascal. So, in a recent meeting I attended with Pascal, Pascal shared a very interesting quote. She said, "Women are not dying because of diseases we can't treat. They're dying because societies have yet to make the decision that their lives are worthy of saving." And so, reflecting on this, many in our field consider the rising rates of maternal mortality as one of the biggest failures in women's health. So, let's hear from Pascal about how midwives close the gap.
We released the latest report on maternal mortality last month. And exceptionally, we looked at the humanitarian emergencies, and the data showed just how dangerous it is to be a pregnant woman living in these fragile settings. Nearly 2/3 of global maternal deaths now occur in countries affected by fragility or conflict. And for women in these settings, the risks are staggering. A 15-year-old girl faces a 1 in 51 risk of dying from a maternal cause over her lifetime, compared to 1 in 593 in more stable countries. And we have obviously examples of specific countries where this happens. So in the chaos of conflict, priorities become painfully clear. And so whether the emergency is political, environmental, or economic, one truth does remain, that as health systems collapse under the weight of crises, girls still become pregnant, some by choice, many not. People still love, still hope, and still have sex. Still have sex, guys. Still conceive. Women still go into labor and they still give birth. And we see this across the world in every emergency. Sexual and reproductive health needs do not pause. People still seek contraception. Women still experience miscarriages. Girls still face sexual violence, and births do not wait for stability. And yet, time and time again, emergency response plans are written without SRHR at the center. And midwives, those with the exact expertise needed to respond, are left undervalued, under-resourced, under-recognized, and overburdened. This is not a professional oversight. It is a structural failure, one rooted in social hierarchies and gender norms that tell us that some forms of care matter more than others, that some titles deserve more respect, more pay, and more voice. And it is a dangerous fiction. And the evidence is clear that midwives save lives. I've heard that all through this afternoon. The best outcomes are achieved when the same midwife or team of midwives provides care throughout pregnancy, childbirth, and the postnatal period. This continuity builds trust and respect, offering a personalized and consistent experience for women and their families. Midwives hold the fabric of maternal and newborn health together, especially in the most fragile setting.
Incredible. Thank you for that. Next, I want to shift to Nina. Nina very powerfully reflected on the fact that we keep putting midwives in a very stereotypical frame, that midwives are only delivering babies, and that women's health is only focused on reproductive functions. But Nina shared her experience as a midwife ensuring dignity and respect while responding to sexual violence in humanitarian settings. So, Anna, can I kindly ask you to queue up Nina next?
My name is Nina, and thank you for the very kind introduction. It is really such an honor being here today. In Denmark, I have worked in highly specialized hospitals with what now feels like unlimited resources. I enjoyed my work, but I sometimes felt quite trapped within the field. However, working abroad and experiencing the broader scope of midwifery allowed me to find my true passion, and that is addressing sexual and gender-based violence. Today, I'm here as a member of Doctors Without Borders to talk about my experiences as a midwife working in crisis settings. People at home are often surprised when I tell them that I'm a midwife that doesn't do deliveries. They often ask me if I'm a real midwife, to which I, of course, answer yes, because midwifery is more than childbirth. Today, I want to talk about my latest mission in Lesbos, Greece, where I was stationed for 6 months. For those who are not familiar, Lesbos is an island in the Mediterranean Sea, close to Turkey. It is a migration hotspot with thousands of people crossing each year in overcrowded boats, sometimes with fatal consequences. Like all other refugee camps, it is not a place of comfort. People live in overcrowded tents, often multiple families squeezed into small spaces and lacking other basic human needs. Outside of the camp is the MSF clinic where I worked as a midwife. I was managing SRH activities and providing care in family planning, STI screening, gynae consultations, and support for survivors of sexual violence. The majority of survivors were women from West Africa and conflict zones that had experienced sexual violence either in their country of origin, during migration, or both. For many, arriving at the camp was the first opportunity to seek healthcare without risking imprisonment and the first chance to disclose their trauma. Survivors had experienced grooming, intimate partner violence, forced marriage, FGM, rape, trafficking, and obstetric violence. Working with survivors means being confronted with the utmost cruelty and very worst of humanity. Hearing the extent to which perpetrators will go is a terrifying and a testimony to the systematic violence against survivors. There is a lot at stake when coming for a sexual violence consultation. First, allowing oneself to be vulnerable in opening up for trauma and consensually undergo medical exams with the risk of being positive for STIs or pregnancy. Many of the women I have met had become pregnant as a result of rape. And because of the circumstances of migration, of constant movement, unsafe living conditions, and limited access to healthcare, many of them could not access safe abortion services. In some cases, restrictive laws or lack of services meant that they were forced to continue pregnancies they did not choose. As a midwife, I supported women throughout their pregnancies, offering not just medical care, but also emotional support, reassurance, and dignity. Carrying a pregnancy born from violence can be an incredible, complex, and painful journey. It was my role to create a space where women could be heard without judgment, where their choices and feeling were respected, and where they could reclaim some control over their own bodies and future. With my midwifery background, it became clear that to me, midwifery is not only about delivering babies. It is about standing with women through the lifespan and the many needs relating to sexual and reproductive health, even the most painful ones. And the stories that affected me the most were those where women had the courage and the strength to escape, but when seeking help, were either sent back to their perpetrators or abused by those who were supposed to protect them. My faith in humanity was somewhat restored when I witnessed how women help women, even in the hardest times. Working in Lesbos showed me that even in the darkest places, midwives can be a lifeline, offering not just clinical care, but dignity, safety, and trust. We often talk about resilience among the women that we serve, but I want to acknowledge the resilience midwives must carry too. In crisis settings, we are asked to stretch beyond traditional roles, to adapt, to advocate fiercely, and sometimes to simply hold space for someone's pain. Being a midwife in crisis is not just a job, it is an act of solidarity. It is about choosing every day to believe in the power of healing, even when surrounded by injustice. And to my fellow midwives, never underestimate the impact that you have, even in the smallest acts. A respectful consultation, a safe touch, a moment of listening, it matters. It saves lives, even when the world feels broken. Thank you.
Powerful, powerful words from Nina. And really helping shift our thinking around what does that woman-centered care look like in the harshest of settings. Next, I want to turn, after hearing from two midwives, I want to turn to you, Dr. Faisal, an OBGYN working in Lebanon. So I want to hear from you, from your perspective, around what does it look like to provide woman-centered care, to ensure women's health, particularly with the stigma associated with almost every aspect of women's health, whether it's menstruation, menopause, fertility, sexual dysfunction, or cancers. And would love to hear from you, what's the role of midwives in doing that? Over to you.
Thank you very much. Thank you, Merit. Thank you for the invitation. Hello, everyone. I'm very proud being here in solidarity with ICM and with the midwives. And I think, as your survey had shown, as my friends spoke before me, you cannot have a woman's health care if it is fragmented. You cannot claim to be a woman's health provider if you keep on fixing dysfunctional aspects of one organ or the other in the bikini area or outside the bikini area. So, as Jacqueline said, there is no one left behind, and there is no age group left behind, and there is no complaint left behind. By 2050, there will be 2 billion and 200 million women transitioning menopause. There will be 100 million in the Arab world transitioning menopause in our region. There will be, and currently, more than 60% of women reporting one complaint or the other of a sexual dysfunction and sexual performance. And there will be more than 70% having problem with access, utilization, awareness around menstruation. So if we have to adopt a life cycle approach, whether under SDG 2030, under the other global organization understanding, we have to adopt a life course approach that incorporates menstruation in all its aspects, sexual health, and also, of course, the menopause. You cannot do without this. You cannot claim you're doing a care without this. You cannot claim a woman-centered care without this. And that is very much constructed by a lot of social issues, traditional issues, a lot of injustice, and a lot of taboos that you have to deal with. And I think as an OBGYN, as a past president of FIGO and sitting on many places, an OBGYN cannot do this. Cannot do this in the first place, and cannot do this alone in the second place. And I think the thinking that we're doing now in shifting care to woman-centered care also should mean transformation of primary health care or healthcare delivery from a physician-centered to a also team-centered care. And that is the way it should happen. And that's where, and I know that very well from my work under the humanitarian complex in Lebanon and the amazing role of midwives in really mitigating the harm inflicted upon women, whether it is a maternal or in the sexual reproductive health and rights. I know that role very well. And also we know very well from our discussion at the WHO highest level, the importance now of shifting and giving more and more place in care for midwives and for midwifery care. That kind of shift, not only in the thinking, but also in the actual provision of care, will definitely be accomplished with the greatest contribution from the midwives. Why? Because one, the nature of their training and education. Second, the way, the approach by midwives towards comprehensive care, towards this psychosocial, biomedical model. And most importantly, is that the visualization of women's health across a life course. And I think it's very important that we move into another level of collaboration as healthcare providers, primarily as midwives, OBGYN, nurses, primary care physicians, to make that important shift that cannot wait for us. You see what I mean? I mean, that thing is happening. So you have to be part of what's happening, promote it, push it, so that we can not only achieve SDG 2030, but we can achieve higher levels of women's health and well-being. And thank you very much.
Thank you so much, Dr. Faisal. It's very inspiring to hear about obstetricians advocating for midwives and valuing the role that midwives play in addressing women's health. So thank you for your reflections, and thank you for highlighting the need to address the stigma. And I think it's important, I guess, to also note that today, in addition to being the International Day of Action for Women's Health, it's also the International Day for Menstrual Hygiene. So it's a joint advocacy that we're doing all around to try to really take away this taboo, continue to center women, continue to center dignity and respect for all.
Exactly.
Thank you so much.
Thank you.
I want to zoom out a little bit now and reflect on the size of the women's health gap. So, as Jacqueline mentioned in her intervention, the World Economic Forum recently concluded that closing the women's health gap could benefit almost 4 billion women and add at least $1 trillion every year by 2040. Yet, we don't see midwives central in that conversation. Yet, we also know that midwives provide about 90% of essential sexual, reproductive, maternal, newborn, and adolescent health, particularly in low resource settings and in crises. So I want to shift next to Kathleen, a member of the World Economic Forum's Global Women's Health Alliance, to tell us a little bit more about what's being done to close the women's health gap and how midwives are part of this solution.
Hi, my name is Kathleen Sherwin. I'm the Chief Strategy Engagement Officer at Plan International and a proud champion of the Global Alliance for Women's Health. So one of the questions I was asked was really, how is the WEF Global Alliance for Women's Health addressing the women's health gap? As a multi-sector platform shaping the future of women's health, WEF's Global Alliance for Women's Health recognizes that women are often the foundation of healthy families, thriving communities, and productive economies, and that there's a real critical need to address ongoing gaps and accelerate progress for women's health for the benefit of all. The Alliance is committed to changing how women's health is researched, funded, and advocated for in order to close the women's health gap, centering the discussion on women's health in global forums, unlocking more investments in financing for women's health, and of course, advocating for health research and innovation. I'm honored to be a champion for women's health via the Alliance, and along with a community of senior global leaders who are inspiring change across various industries and sectors. It's imperative that we continue to amplify and center women and girls' voices in these conversations, safeguard their agency to exercise bodily autonomy, mainstream women and girls' health across the healthcare spectrum, and maximize their social and political capital. By working collectively and collaborating with governments, NGOs, and the private sector, we can develop cost-effective solutions that will change lives, providing adolescent girls with access to quality education, health services, and SRHR lays at the foundation for a brighter future and economic prosperity, uplifting them and breaking the cycle of poverty. Convening through innovative platforms like WEF and the Alliance, we can bring together diverse stakeholders to ensure that women's and girls' health is not just the right thing to do, but it has positive social and economic impacts that can be transformative, with the entire women's health gap potentially presenting a $1 trillion opportunity by 2040. One really important aspect to unlocking this is midwives. Within the current global landscape, where we see fewer resources being invested in global health despite the enormous and ever-increasing needs, we have to work smarter and leverage the amazing resources that already exist, and midwives are a key to filling the women's health gap, from delivering health services at the local level to advocating for more holistic care at the national, regional, and global levels. So despite the persistent notion or myth that midwives are only concerned with pre and postnatal care, they do so much more than deliver babies. They're often the first responders for women and girls' health needs across the life cycle. Midwives are embedded within communities and can offer understanding, awareness, and best practices that speak to women and girls within their context in ways that outsiders can't. And because midwives are located in the community, they can offer outreach activities to girls at risk of adolescent pregnancy and those who are pregnant and parenting. They can provide an important link between pregnant girls and health and protection services, ensuring follow-up and support. Particularly in crisis situations when health systems break down, midwives often become the only health providers communities can access and can make all the difference when it comes to safeguarding SRHR, maternal, newborn, and adolescent health. They offer critical life-saving services while upholding dignity and protecting rights in the most challenging of situations. At Plan International, our focus on local communities very much also centers around midwives as key partners for women's health. We know that midwives are essential to raising awareness on key health messages, educating women, girls, and families on the importance of sanitation, nutrition, vaccines, in addition to family planning and pre and postnatal care, ensuring improving access to life-saving maternal and newborn and SRHR care. So you might be asking, why do we need to scale up midwives to close the gap in women's health? Throughout most of human history, childbirth was a female-led, community-oriented activity. A midwife was often a local woman who had experienced giving birth themselves and would feel called to help other women with or without special training or payment for their services. Over time, midwifery developed as a formal profession of women helping other women and girls through this major life event, passing on wisdom, training, and knowledge about birth to each other through formal education programs, apprenticeships, or either. National and international evidence consistently reports that births attended by midwives have fewer interventions, fewer cesarean deliveries, fewer preterm births, fewer inductions of labor, and more vaginal births after cesarean delivery. In addition, midwifery care is consistently associated with respectful care and high patient satisfaction. While not necessarily applicable to all parts of the world, some research done in the United States has pointed to evidence that states with the highest level of midwifery integration tend to have the best healthcare scores for their population, where states with the lowest rates of midwifery integration tend to have the highest rates of newborn mortality and the lowest rates of breastfeeding. So in short, scaling up midwives is an evidence-based, cost-effective investment we can make to close the gap in women's health, as they are often already present or have access to the most vulnerable of communities. They are usually trusted advisors who work within local contexts and cultures with the ability to share knowledge and best practices in a way that outsiders cannot. So I am again a very proud champion of the WEF Alliance and look forward for you joining us on this important fight. Thank you.
Incredible reflections from Kathleen, and I especially love the focus and the integration of the advocacy for adolescent girls, which I know many of you on this call are fierce advocates for adolescent girls in this larger movement for rights and for women and for midwives. So, and I see many of you in the chat are wanting to connect, so allow us a few more reflections and we'll give you the QR code to sign the push pledge and to join the movement. In the meantime, I'll ask my colleague Bruna to put the link in the chat already for those of you who are interested. Next, I would like to shift to Dr. Natalia Kanem, who can highlight a little bit more about what are we doing at the global level to ensure that midwives are integrated as a key solution to close this workforce gap through the newly launched Midwifery Accelerator.
And newborns, and even midwives are central to the health and well-being of women and newborns, and even more so during turbulent times. UNFPA is so proud to partner with the International Confederation of Midwives, on the brand new, game-changing, strategic Midwifery Accelerator. It's a blueprint we've achieved together to boost the training of new midwives and close that midwifery workforce gap. It's all a part of ending preventable maternal and newborn deaths by the year 2030. Join us because a strong, capable midwife delivers the quality care women want and need to make childbirth safe, as well as the compassionate care that makes birthing the joyous occasion it was meant to be. Midwives come to the rescue in the direst of circumstances. When crisis strikes, they're often the first on the scene to bring life-saving care, to provide that birth support in conflict-affected places. The risk of dying from pregnancy more than doubles during crisis. Yet somehow, midwifery today is under-recognized, it's underutilized, and it's underfunded. This despite overwhelming and long-standing evidence that the midwifery model of care is one of the best buys in public health.
Thank you. So, with that in mind, I want to extend this invitation to all of you. Now that you've heard from some of our global health experts who are also women-centered care champions, I want to remind all of you that this movement is not just for the executive directors of UN organizations or esteemed professors, but this is everyone's movement. So, without further ado, I want to introduce to you how you can join the movement, how you can engage, before we jump and hear from more of our women-centered care champions around the world. Here is the QR code to sign the Push Pledge. The Push Pledge is the unifying first step for everyone to join the campaign. It takes into account 3 commitments that you will make, that you agree to the push principles, which can be found on the website, and there are 5 simple unifying principles: pushing for rights, women, and midwives. The second is a simple commitment that many of you, I'm sure, are already doing, to talk about respectful, woman-centered care to people in your life. And the third step is, again, this global solidarity of us coming together and acting locally and globally to promote midwives and woman-centered care. There are 4 types of woman-centered care champions: from the individual level, from the grassroots level, to the INGO or the larger advocacy groups working on policy, and to the investors. The first step for all of these is to sign the Push Pledge. And you can see the QR code here. My colleagues have graciously put the link in the chat. And the part of the event that you have all been waiting for and have been excited about. I'm going to kindly ask my colleague Anna to pull up this next video, which is meeting the women-centered care champions from around the world through our pledge drive. So, next section of our event, we are going to visit 10 countries from around the world and hear from women-centered care champions who've signed the Push Pledge and submitted their statements of support about why we are pushing for midwives as the key to women's health. These champions represent different levels, different sectors, ranging from grassroots organizations, UN partners, doctors, nurses, midwives, doulas, activists, researchers, women's health and rights movements, global, regional, and national actors, non-governmental organization, and the private sector, including the femtech industry. I see so many of you already joining this webinar, and it's an honor to have you with us. And so without further ado, let's play this video and extend this invitation to celebrate the women-centered care champions around the world and to grow the movement beyond borders and sectors. Thank you for queuing up the video.
I am Ana Vélez. I am a midwife myself, and I am part of the Women in Global Health Switzerland chapter. We midwives can provide up to 90% of sexual reproductive health services. We can prevent 67% of maternal deaths. And for every single dollar invested in midwives, you get a return on investment of 16 times. This is $16 back for every single dollar you invest. And this is why I push for midwives.
Hello, I'm Arwa. I'm from Tunisia. I represent ARMAG, the Arab Regional Midwifery Advisory Group. I push for midwives because they are the key to improve women's health and rights. They reduce maternal and neonatal mortality. Midwives stand beside women through every stage of life. They empower them with information, support, and choices in their sexual and reproductive health. They promote equity, justice, and the right for every woman to be heard and cared for. This is why I believe in midwives. This is why I push for midwives.
My name is Dr. Aman, CEO, Forum for Women Development and Research, White Women Alliance Pakistan chapter. I push for midwives because they are the backbone of maternal and newborn care, especially in communities where access to healthcare is limited. Midwives are not just the caregivers during childbirth, they are trusted allies for all women during their entire reproductive health journey. In Pakistan and beyond, when midwives are well trained, well supported, and integrated within the health system, we see a dramatic improvement in maternal and neonatal outcomes. So investment in midwives is investing in healthier mothers, safer births, and stronger communities. This is why I and my colleagues in Pakistan push for midwives.
Hello, my name is Paulina Ospina. I am Director of Programs at Direct Relief, an NGO that delivers humanitarian medical aid globally. Supporting midwives has been our longest and most consistent focus for our maternal and neonatal health programs, because midwives deliver a cost-effective and comprehensive way to address health outcomes, which is why in disaster settings, Direct Relief often addresses these needs by ensuring midwives are well-resourced and able to care for their patients. When health infrastructure is affected and normal service delivery models are impacted, midwives are at the front lines, addressing the needs of their communities by meeting their patients where they are at. Direct Relief has seen midwives arrive in emergency zones by any means necessary, mobilizing health caravans to earthquake-affected and difficult-to-access mountainous villages, arriving by canoe in flood-affected zones. We've seen them set up birthing tents at refugee border crossings, and we've even seen them arriving by jet ski, which was the case in the 2023 Hawaii fires in Lanai, where midwives were some of the first responders on the scene. Midwives find a way, no matter the circumstances, to care for their communities, and that is why Direct Relief makes it a point to ensure that they are well-resourced to do the jobs that they were trained for. This is why we support midwives as a key component of women's health.
Hello everyone, my name is Jihan Salat, and I'm a member of the Align MNH Steering Committee. I push for midwives because every woman deserves care that is life-saving, evidence-based, and respectful. In many humanitarian settings, when everything else is gone, when the hospital isn't functioning, the doctor isn't available, and there isn't enough medication to meet the needs, a midwife is still there. She does not give up, and most certainly, she will not leave the woman she cares for behind. Each year, millions of lives are saved by midwives globally. They handle critical emergencies, they help women make informed decisions, and they provide continuous, compassionate care. This is the remarkable impact that midwives already have. But imagine how many more lives could be saved if all midwives received the necessary tools and resources to fully practice their profession. I believe our world would be a much healthier and safer place, and this is why I push for midwives.
Dr. Joy Queer Perry, the founder and president of the National Birth Equity Collaborative. I love midwives because as an OBGYN, I know the world is run by midwives. And it saddens me that my field of obstetrics and gynecology decimated grand midwifery here in the United States to create our field. So that origin story needs to be reborn, a story that says that women and midwives are really the center of how we birthed a new revolution of justice and joy for all. This is why I push for midwives.
My name is Ayşegül Bozbaltacı, and I'm a doula, and one of the 3 core organizers with the European Doula Network, proudly working in alignment with the ICM Push campaign. We push for midwives because their work is essential for ensuring respectful and woman-centered care. As doulas, we witness daily how midwives provide skilled compassionate support that honors each woman's autonomy and voice. We believe that when doulas and midwives work together, outcomes improve and women feel safer, more empowered, and respected throughout their birth journey. On May 5, we issued our manifesto, Doulas Support Midwives, and we launched our survey, Feedback on Doula Support, to gather valuable insights, foster dialogue, and deepen mutual understanding. Doulas and midwives stand side by side, each with a unique role. We believe collaboration, not competition, is the future of maternal health, a future where each role is valued and every woman receives the care she deserves. This is why we push for midwives.
My name is Humphrey Beja from the National Midwives Association of Uganda. I push for midwives because midwives offer 90% of essential sexual, reproductive, maternal, newborn and adolescent health interventions, even in times of crisis. Yet, they are underrepresented at decision-making tables. The care provided by midwives prioritizes the individual needs and choices of women, ensuring that women actively take part in decision-making about their care throughout their entire maternity journey. If midwifery-led model of care is to be fully implemented by 2035, over 60% of maternal deaths, including stillbirths, could be averted. This is why I push for midwives.
Hi, I'm Franca Cadet from Maternity Foundation, and I'm a very proud midwife. Maternity Foundation pushes for midwives because we know it's the humane and the smart thing to do, because the return on investing in midwives is 16-fold. I even think this is an underestimation. We know there is a big shortage of midwives, and so the pressure on midwives is huge. And that's why we invest in state-of-the-art technology for gamified, on-the-job, evidence-based upskilling of those hard-working midwives using the free Safe Delivery app. It can even be used offline in remote settings, so midwives don't need to leave their facility where they're so needed, while improving their knowledge and skills at their own pace. And you know, we have the data that it shows it works. Evidence shows that midwives can do up to 90% of maternal newborn health services, and I believe midwives are ambitious and want to give evidence-based, compassionate care. Our 19 Safe Delivery app modules span the continuum of midwifery care, have contextualized visuals, and it's currently available in 38 languages. The Safe Delivery app can also be used by midwives to gain continual professional development, or CPD points, for regulation. And last but not least, the Safe Delivery app is made for midwives by midwives. The evidence shows that midwives stand at the basis of a healthy future, and that is why we push for midwives.
My name is Duduzi Dlamin. I'm an advocacy manager for Sex Workers Education and Advocacy Task Force, SWET, and I am also the founder of Mothers for the Future, working with mothers who are doing sex work in South Africa. We are advocating for full decriminalization of sex work in South Africa, and the important for sex workers to be able to access their sexual reproductive health rights. And for that reason, we fully support midwives and what their role they play in the health of women.
I'm Casey Selzer, a midwife since 2007 and senior director at ULA Health. I push for midwives because they close the health equity gap and improve perinatal outcomes. Midwives transform healthcare economies and outcomes. Across health systems like Mount Sinai West and Stanford Health, they provide culturally competent care that reduces interventions, improves satisfaction, and delivers cost-efficient results. Research shows that birthing people want holistic and patient-centered care. Once they meet their midwives, they understand these midwives are part of the solution. The result? Better outcomes and stronger communities. The math is pretty simple. Midwives equal better health outcomes at lower costs. With 3.9 billion women globally, That's $1 trillion economic benefit. I push for midwives because they are the architects of a healthier and more equitable world. When we empower midwives, we empower all birthing people, and we can transform economies. Join us today in making midwives central to the global health solution.
Thank you to all of these incredible women-centered care champions from around the world. And now the part of the event that all of you have been waiting for. How do you join the PUSH campaign? I'd like to introduce my dear friend and colleague, Anna, who is going to walk us and invite all of you through steps in how to join the movement.
Hi, everyone. It's a pleasure being here with you. I'm Ana Gutierrez. I'm the communications lead for ICM. And as Meret said, I'm going to explain to you how to join the movement. I know we're a little bit over time, so I promise I will make this as fast and as interesting as possible. So as Meret and most of the speakers have said, almost anyone can join the PUSH campaign. The only thing that you need to do is sign the PUSH pledge. To sign the PUSH pledge, you can either scan the QR code that's in this slide, or we can post the link on the chat. To sign the PUSH pledge, you first have to agree with the PUSH principles and agree with the other 3 points of the PUSH pledge. But it's very straightforward, very easy. And if you're interested in pushing for midwives and women-centered care, this is a place to do it. It's a very simple and straightforward form. But to fill it out, you need to know what level of engagement you're interested in. So Meret, can you please put the next slide up? So we've created 4 tiers of engagement catered for anyone who wants to join the campaign. So whether you're an individual who's really interested in promoting women-centered care, or whether you're a big corporation who wants to invest in this campaign, we have a space for you in all of our plans moving forward. So if you want to sign up to be an advocate, each of the tiers of engagement has something that we expect in return. So you've signed the pledge, and then we hope that you will engage with the campaign in different ways, because if not, why are you signing the pledge? So if you want to become an advocate, we hope that you would submit a story or a narrative or a quote around why you push for women-centered care and midwives, or a story of a personal moment in your life where you realized why women-centered care is important. And we hope that you can amplify the campaign with your networks, with people who you work with other women who you know might be interested to join the campaign. If you want to become a campaigner, which is for grassroots organizations, and for example, member associations can also be campaigners. We hope that you can mobilize other allies to change the narrative. You can include midwives and women-centered care within the work that you're doing, within the articles that you publish, within your internal documents, so more people can start thinking and speaking about women-centered care. And you can also organize a campaign, a community dialogue, a policy dialogue, a roundtable, or anything that mobilizes and gets people talking about women-centered care and midwives. This on top of all of the things that you can do as an advocate. So these things are just compounding things that you can keep piling on. And then as a collaborator, we hope that you can convene other allies. We hope that you can co-lead advocacy activities with us, like hosting events like this one, maybe creating a report together, maybe writing an article together, and just building the movement as a team. And in the future, we hope we can co-create social media campaigns and other types of campaigns together. And as an investor, the main point of this is to invest in the PUSH campaign and help us find other people who might be interested in investing. It doesn't have to be a big investment. It can be small, and we can grow from there. So now that you know the ways that you can engage, you can sign the PUSH pledge and be a part of this community. What's interesting, we also, of course, need to give you something back, because you're agreeing to do a lot of things for us, and we need to help you in those efforts. So what will you get from us? Depending on the level of engagement that you decide to select, you will get a different series, like a different package, let's call it. That package is being sent out. It's going to go out in 5 minutes from now to all of the people who have already signed the pledge. And after that, it will be automated for anyone who signs the pledge. They will automatically get this package. So what you will get is a series of digital assets that will help you spread the message. I will show you the digital assets in the next slide. You will get a form where you can share your personal story, campaign, resource, or message to contribute to the movement. I will also go through the many ways of that you can submit stories or content for us. You can submit your logo, so everyone from, not the advocate because that's made for individuals, but campaigners, collaborators, and funders can all get their logos within the push webpage. We'll create a full page for all of our partners to live in. That way you also get visibility and more people visiting your site and your work. You will get exclusive opportunities to co-create campaign materials, research, and other multiple things that we might create in the future. And you will have the opportunity for biannually showcasing your work on our social media platforms, newsletter, and many other digital assets that we will be distributing. So you're basically gaining access to our network because you're giving us access to yours. So next slide, Maret. We put together a series of digital assets that we think you will enjoy sharing on your social media platforms. We have very basic ones, like I'm proud to commit to push for rights, push for women, push for midwives. And then we have others that you can edit and add your touch to them, like adding why you push for women, or adding a quote and a picture from someone within your leadership or from yourself about why you're joining the campaign. So you can post it on social media and you can prompt other people to learn more about the campaign. And you can proudly show that you're engaged with a movement that so strongly calls for women-centered care for all. You will get all of these, and some of them are editable, some of them are not, so you can pick and choose what best suits your needs and your digital skills. Next slide, please. And lastly, for your story, what do we want to get from you? So we want to get stories, resources, events, quotes, videos, anything that you want to send our way that has to do with midwives or women-centered care. So we put together this very comprehensive submission form in which you can select what you want to submit and how you want to submit it. You might be wondering, what are we going to use this for? So this is going to be used to create a bigger narrative and show the world the effect that midwives and women-centered care have in communities and individuals and organizations and in any other context that you want to share with us. So let's say that you have 3 kids and 2 of them were born through a C-section, and the third one was born with a midwife through women-centered care, and you felt empowered and you felt that it was different to the rest of them. That's a story we want to hear, because that's a story that might empower other women to read up on what women-centered care is and what the role of midwives is. Let's say that you're working on a research project analyzing the effects of midwifery in your community. We want to hear from you, and even if the research is not out there, we want to contribute to it. We want to expand it. If you have a survey, we can also push it through our social media channels. So just feel free to share with us anything that you have on this topic, which is very broad. And we don't promise that everything that we get shared is going to be shared, because we might not all of it might be as relevant as we would want it to be. But most of it, and whatever is aligned with the push campaign, will get out there in some sort of way. So it's an open platform for all of you to share what you're doing so we can make it bigger. You can also scan the QR code to submit your story, but if you sign the push pledge, you will get it to your inbox. And next slide. So now that you've heard how we plan to support your advocacy, we would like to know what else we can do to support your advocacy. So how can we help you push for midwives and women's health? You can submit 1 word, 2 words, a small phrase, and all of those will be taken into account so that in the future we can create bigger things, maybe a toolkit, maybe more events, maybe a course of some sort, a report. Anything here is welcome. And if you have any ideas, you can also send them to us via email or through the webpage. So I will pass it over now to Maret, who will close up the event.
Thank you so much, Anna, and thank you to all of you for joining. I know we're a little bit over our time, but we had so many exciting things to share with you, so many inspiring commitments and stories from the Push campaign and women-centered care champions around the world, with an invitation for all of you to also add your voice. So We welcome all your ideas. As Anna mentioned, we would love to hear from you. Please feel free to submit your comments, your stories, to engage with us on social media. If there are any additional comments, feel free to write us on email or through any of the other opportunities to connect. So with that, we want to wish you a very happy International Day of Action for Women's Health. And let's keep pushing for rights for women and for midwives. Thank you all.